Lydia Bell, and I'm at International Congress in the capacity of a social media champion, and I'm here to interview Kalidindi. So Sri, you've just given us a very interesting talk. Would you like to summarise the key points?
Yes, so the talk that I gave today was about integration for rehabilitation psychiatry, and I talked about the Getting It Right First Time programme, which is run through NHS Improvement and NHS England. So I'm the clinical lead for that. It's a huge opportunity for us to really upgrade and improve rehabilitation psychiatry services across the country. Right now there's so much variability in how it's how people receive their services. There are a lot of issues with people being miles away from their own homes and communities and their families, and there are lots of different ways to do this kind of rehab services. We set them up, and really this work is about getting the data across the whole country, saying where are people doing good work, where's the what we call unwarranted variation, i.e. where are people doing stuff that's less good, and how do we support people to learn from one another where people are doing well, but also say what's your action plan of how you're going to move from where you are now to an improved position. Of course that never ends.
Yeah.
We're constantly improving, and really trying to make sure that we get it right for patients, our service users, and for carers. And by doing that, actually the whole system benefits, because this group of people are they have high needs, they are expensive to provide care for, they have complexity of needs. If you can get it right for this kind of 15-20% of people in secondary mental health care services. So by getting it right for this 20% of the population, they have high needs, they have complex sort of mental and physical health conditions, and social care needs. So if we get it right for them, because it also costs quite a lot, it costs about 40-50% of the annual entire health and social care spend for this small group of people, then clearly you can, as well as giving those people better lives, you can also release some of that money and use it better for other parts of the mental health system. So I'm really so delighted to be part of this and to support other people in their work to really work to improve things for this often neglected group of people, actually.
So if there's people watching this video who want to get involved in the Getting It Right First Time movement, what can they do? So
I'm on Twitter at skalidindi1. I've got work at South London and Maudsley. They can contact me there on my email. And I think it's about thinking where their people who have rehab needs are in the system locally, and trying to improve what the current offer is for them. We do need people to get the data together, so that's going to Mental Health Trust data people, but it's also going to the executives and medical directors, and we want the clinicians and the team leaders of rehab units to get involved to understand what their data is, so we can move to support them to move towards a better position. I'm hoping that there will be some funds linked to this work as well. We don't have anything definitive, but the first thing would be getting people back from out of area placements. It's not best care. And actually, if we get down to it, I always put myself in the position of if that was my family member or me, long way from home, when I'm very unwell, not really able to advocate for myself. It's not a good position. I don't think that we should tolerate it anymore. It's not an easy thing to say we shouldn't tolerate it anymore. To actually get it right then from that. But I just feel like we can't keep making excuses.
Yeah. So what?
And so the other thing to say about that is, I don't think we can keep making excuses, but I think this is not just about mental health, it's not just about psychiatrists and psychiatry, it is about the whole system. It's about making sure that our health and social care leaders in all areas are on board with this as well. It's their responsibility it's all of our responsibility to get better care for this group of people. So we need to get them on board and get to that better position.
So in an ideal world, what does good look like? What would it look like?
So in an ideal world, good would look like, for me, using what we know to be good care from an evidence base, making sure that people are identified early if they're heading to more complex needs, so they get early intervention. So, for example, picking up people in early intervention psychosis services who are more complex, get them into the rehab kind of component of care early. Or if you've got people stuck on your acute wards who clearly need rehab, get that care to them early. And so that you can, wherever possible, avoid people going up the pathway into rehab settings which might be restricted for longer periods of time. But if they do need that, give it to them early and use the data, use the evidence base to give people the right evidence-based care more quickly. As downstream as you can get it, but when they do need it, make sure you've got good local rehab care so people don't have to be sent out of area. And it's very much that whole system working as well.
Yeah.
Health, social care, voluntary sector, housing, everybody working together to make sure that individuals can live in the community successfully, the lives that they want, integrated into their communities, linked up with family and friends, working, paid or voluntary, whatever's right for them and at their pace.
Yeah. So there may be some students or foundation doctors watching this, wondering whether they should choose psychiatry. So what are your thoughts on whether they should choose psychiatry and why?
Psychiatry is incredibly rewarding. So being part of somebody's journey when they have been in an incredibly challenging and difficult place in their life, being able to support them to get to a much better place is just a huge privilege. So I would definitely say choose psychiatry. It's never dull. It's fantastic working as a multidisciplinary team as well, and holding hope for people when they don't have it for themselves, and seeing people come out the other end is incredible.
Brilliant.
Do it.
Thank you very much for your time.
Okay, pleasure. Thank you.